Hi, my name is Melanie Oliver and I'm the Director for Innovation in Local Government for Nesta. And my colleague Katie, who's sitting here, who's going to jointly present with me over the next half hour, is one of our senior programme managers for Nesta as well, leading particularly on creative councils at the moment. So I hope all the technology is going to work for me. Okay. So, we thought in the next half hour it would be really useful, having had a conversation with Alex in terms of what would be most useful for you this morning, is that we were going to talk a little bit about how do we define innovation, what do we mean by that, what is Nesta's role and why does Nesta exist, what's its purpose, how can it help local councils in particular, how do we do innovation, the kind of methodology that's been developing over time and how we can impart some of that knowledge to you that might be useful. And then thinking particularly about a couple of examples that we'll give you on the ground. One of them was radical efficiency, which was around transforming early years that happened across the UK. And the other one, which is live at the moment, is the Creative Councils programme, which I understand Islington did originally bid for and got through to the 17. It shortlisted from 137 to 17. Islington was part of that. So those are our kind of objectives for the morning. We hope those are the things that you're going to find most useful. The first thing is around the definition of innovation. There are lots of definitions about innovation, and we did kind of think about doing a shout out, asking you guys to kind of tell us what you think innovation is about. But we know when we do that, often what we get back is people start talking about Steve Jobs and Apple and things like that, and it kind of gets quite technology driven. And we're really keen to kind of think about innovation isn't just about the world of technology, but it's actually about how do you get innovation, social innovation, into public services. It's the same with design. We tend to think of design as around kind of product production, whereas in fact what we do know is that actually you can get huge amounts of social innovation into people's services as well. So for us, innovation is very much around doing things differently, doing them at lower cost and doing them better. And it resonates very much with Leslie's slide, I think. The only thing I would add to Leslie's slide is that we can't actually achieve the challenge, I think, that you guys are facing, and you're not alone, obviously, it's across the whole of the UK, just by service improvement or by incremental change. It has to be done by thinking very differently, radically differently about the way in which we currently deliver services. So the challenge is about doing it at lower cost, is about actually achieving our priorities, but the only way to do that is not through salami slicing our budgets, but actually radically thinking differently about the way in which they're designed in the first place. And what we're really keen on is actually to think about how do we bring good ideas to the fore, into practice, that really help change people's lives and actually are what people want. So, as I was saying, we don't do the shout out because we think we kind of know you're going to talk about things like Steve Jobs and Apple and those great innovations that have happened. But there are others that we kind of think are useful to think about. One of them, recently, our executive director went to visit the Harlem Children's Zone in New York. And what was really interesting about that particular project is that in terms of housing development, it's kind of fairly standard practice to kind of create this housing and then have a green area in the middle for the children to play in and to kind of have a community space. But actually what they know from that, looking at that, is that actually that becomes the drug zone. That actually is where youths end up hanging out, where drug dealers end up hanging out, where kind of, dysfunctional high-risk behaviour actually tends to occur. So working with that community, they've completely redesigned that. And what they put in the middle was the school. So the housing sits on the around it, and the school actually sits in the green in the middle. And the reason for that is because they felt it gave a very fundamental message about actually that is the focal point of the family's lives, is around education, learning for life, and so on. Another example there for innovation was around the first tablet, the $25 tablet, which was designed in India. And the purpose of that being, how do you bring technology to the billions that live in India at much more fundamental, lower cost, so that actually far more people can become connected with each other, rather than having the kind of high, expensive IT equipment that we maybe have more in the Western world. And those are just a couple of other examples there. First Direct was the first online banking system where people could actually have access to their money 24/7. And those give you just a couple of examples. So, Nesta itself is a charity. It became a charity in April 2012, and its mission really is to help people and organisations bring really good ideas to life. And we do that in a number of different ways, which Katie will talk about in a little bit, but around providing investment, grants, mobilising research, network, skills, etc. And we're funded by an endowment that came from the National Lottery, I think about 10 years ago now. And that's how Nesta ends up, that's how Nesta is funded and how it uses its funding to actually bring those good ideas to practice. So rather than me talk through in detail about that, we have a film that would be useful. So Chris, are you? Great.
Every day, our lives are enriched by bright ideas. From the design and layout of our public spaces, to the trains we travel on. From the computers we use, to children's toys. They all started as someone's bright idea. But even the best ideas face brick walls. People are quick to say, it won't work. Or, if it's such a great idea, why hasn't it been done already? Nesta was created to help people with ideas overcome these barriers. We know that you need the right advice from someone who's been there before, the right skills to grow your idea, and the right knowledge to back it up. Since our inception, we've backed hundreds of great ideas. Ideas like taking some of our most exciting drama and broadcasting it to national and international audiences by beaming live productions into local cinemas. Helping to develop the world's first mobile medical device, giving patients more control over their own care and reducing the burden on our health service. Or supporting the future of our digital industries by helping teach children to write computer games rather than just play them. Over the next few years, we're going to need more ideas to cope with the big challenges we all face. Ideas on how to thrive with an aging population, ideas on how to make money while cutting carbon emissions, and ideas on how to create good jobs for young people. At Nesta, we know how innovation works, and we can give you the skills, the money, and the networks to help make your bright idea happen. Because every giant innovation was once just an idea.
At Nesta, we've developed a theory of innovation which sets out the process for turning a great idea into something that grows and achieves impact. We've drawn on methods used in many fields, from business and science to the third sector and public services. Each field has a distinct way of doing innovation, but they overlap in terms of the tools they use to make innovation happen and the way they think about what needs to happen at each stage of the process. And what I'm hoping is that some of the tools and the methods that I talk about now will be useful to you in thinking about how you might go about innovating in your own service. I think I've gone one too far. Anyway, so we start with the prompts for innovation, and these can take many forms. The prompts could be a crisis or a problem. It could be a political pressure. For example, in my home borough, Lewisham, at the moment, there's a massive campaign around persuading the local health service not to close the A&E service. It could be new evidence, like the evidence that investment in early years support and education can give a higher return than anything else the government can do. What we're interested in at Nesta is how we can systematically prompt innovation, and there are many different methods that can be used. Some of them about analysis, looking at trends and emerging issues. For example, the growth of an ageing population and the numbers of people living with long-term conditions is prompting innovation in health systems around the world. Others draw inspiration from the perspectives of different groups. Frontline professionals, consumers, as well as practitioners and experts all have different kinds of knowledge to bring to the understanding of an issue or a problem. You might use methods for insight generation to better understand the context of people's lives and the realities of people's behaviour. For example, ethnographic researchers shadow people and observe their habits and routines to generate new insights. A number of our creative councils, including Islington, used ethnography in the first phase of the programme to test and develop their innovations. For example, Derbyshire County Council used it to find out about the realities of the lives of children in care. They found that their assumptions as service providers about what those young people need and want to make their lives a success were sometimes utterly wrong, and this has prompted them to make far greater efforts to involve those young people in the design of the services that support them. So the aim for this stage of the innovation process is to be really clear about what problem you're trying to solve or what opportunity you're trying to seize and why. The next stage is to generate ideas. There's a really famous comment by the American chemist Linus Pauling, who's still the only person to have ever won 2 Nobel Prizes. He says that the best way to have a good idea is to have loads and loads of ideas and to discard the bad ones. And what you're trying to do here is to maximise creativity and the menu of options and ideas. Here again, there are many tools that can be used. They include competitions and prizes, ideas marketplaces, brainstorms, and the creation of specialised roles such as thinkers in residence or skunk works. And all are designed to generate imagination and a much longer menu of options. Many organisations find that innovation camps and festivals are a great way to develop significantly more ideas. And you can see some of the examples up on the slide there. What they tend to do is bring together groups of people over 2 to 3 days of intensive activity to come up with new ideas and to work out real examples of how challenges can be solved. For example, of creative councils, and I'm not sure Holly is here, but Holly, one of your managers, will have come to a couple of our camps. We've run 4 innovation camps as part of the programme to help the councils to shape and develop their ideas, challenge themselves and each other about their viability, and plan how to take them forward. Another way to generate ideas is to bring different perspectives into a team or organisation through the creation of specialised roles. I don't know how many of you have heard of skunk works, but it's a popular way to develop ideas and innovation projects in business and technical fields. These are designated teams within an organisation that are tasked with working on secret or advanced projects and are freed entirely from normal bureaucratic constraints. Nesta has also experimented with the use of challenge prizes through programmes like the Big Green Challenge. Challenge prizes are a great way to generate lots of ideas for solving a problem. You set a clear goal, in this case to reduce carbon emissions by communities, and it generates ideas for bidders. And money is ultimately given to those who have the best prospects for achieving a tangible goal. So, the aim of these tools is to generate significantly more ideas. And once you have your long menu of ideas, hopefully as many ideas as possible and as many surprising ideas as possible, the next stage is to put them into practice and to test them out in the real world. So one of the key insights of the innovation field over the last 10 or 20 years is that the best way to test out new ideas is to put them quickly into practice rather than trying to work them out on paper for too long. And this is what we call rapid prototyping in the design world, or beta testing in computing. There are lots of different methods, as you can see, for testing ideas, and they all work to flesh out problems, improve the concept, and to develop market prior to large-scale testing or rollout. So, an example you may have heard of, one of the most famous examples of prototyping is James Dyson's vacuum cleaner. It took them 5 years and over 5,000 prototypes to develop the Dyson. The way they do it is that they start by making lots of prototypes quickly and cheaply from card and foam, and then they make cheap working models from plastic molds. Each prototype uncovers small design flaws and leads to an improved version. Service designers follow similar design process in the creation of services, including mapping customer journeys and touchpoints and testing with end users and customers. And Melanie's going to tell you a bit more about how this worked in practice in Reading Council as part of the Transforming Early Years programme. As Leslie said, usually this work is done best with the close involvement of users or frontline staff to develop and refine the idea in practice. An important thing to do at this stage in innovation is also to look at the economics. How can you improve results relative to cost? And are there ways of simplifying the innovation so there's more chance of the idea being taken up on a large scale? So, having tested an idea, piloted and prototyped it, hopefully you'll have by this stage a good idea of what works and what doesn't. However, it's the nature of innovation that even a very high proportion of the best ideas don't make it through the testing and prototyping stage. The innovation process often involves a series of loops rather than being a straight line, because the very process of testing out an idea throws up new ideas which can be refined, prototyped and tested. But if your idea does get through the selection stage, the question is then how do you embed it, sustain it, and make it part of your daily life? The implementing and embedding stage is all about putting the right people, structures and resources around the innovation. In the public sector, turning a promising idea into a mainstream policy or programme involves budget allocations, training of staff, and sometimes changes to law and regulations to allow, for example, a new way of running primary care services or a new way of running secondary schools so they can become sustainable. Once you've proven that the idea not only works in pilots but can also be sustained, the next question is whether you can grow it, whether it's an idea with potential for scaling beyond a single community, a single school, a single health system. Again, there are lots of different approaches that you might take to grow an innovation. They might include organisational growth, a franchising agreement, or development of licenses. In the private sector, hopefully examples that you all recognise, scaling usually involves the growth of a business. For example, Google has become an enormous business out of essentially a single innovation for advertising relating to search. In other cases, the model might spread through franchising, such as the Body Shop or McDonald's, or it could spread through licensing. ARM, on the right of the screen, is the UK-based creator of 80% of the world's mobile phone chips. And what they do is they license their chip designs to manufacturers around the world, rather than trying to do the manufacturing themselves. In the public sector, the easiest way to scale might be through central government changing the law or policy. So say, for example, you wanted to introduce computer science teaching into all 4,000 secondary schools. The easiest way might be to persuade central government to make it part of the national curriculum. Then in tandem, you might provide support for training teachers and provide materials to help the teachers create and deliver the curriculum. But we think there's really another way at Nesta, and through our Creative Councils programme, we're testing out whether local government can scale its best innovations without having to involve central government. So, for example, Rotherham, one of the councils we've taken through to the last stage of the programme, has an enterprise and education project. And what they've done is to develop a franchise model so they can take the model and shift it to another area. And they've already launched Derbyshire Ready and are looking at launching a Norfolk Ready. So what you're trying to achieve here is innovation or impact at scale. So the final bit of the diagram is the question of systemic change. Many of the most important innovations are not just about a single idea, a single service or a single product, but rather changing the whole way in which we do things. For example, in the field of waste and recycling over the last 20 or 30 years, our whole systems have shifted from filling landfill to much higher proportions of recycling and the use of energy or waste for energy. If we look at what makes this sort of systemic change happen, it turns out it requires many things to change in tandem. Some of them about laws and regulations, such as EU directives requiring 60% of paper to be recycled. Some of them about organisational models. So how do you actually collect different categories of waste from households and businesses? And some of them are about behavioural change. Large-scale recycling will only work if householders are willing to use separate bins for paper, glass, and organic waste. The same things apply in many fields, from criminal justice to long-term care for the elderly, where there's change on a whole sort of range of different fields at once, and change usually takes a long time to happen as a result. So, systemic change is a transformation in the way we do things, and that's what we've been aiming to achieve through programmes like Creative Councils. And this is where I hand back to Melanie.
Okay, I'm just going to talk about two examples that Nesta have worked on. As I was saying earlier on, point that in the right direction. The Creative Councils and the Radical Efficiency Programme. With Creative Councils, we put out a call for an open call for ideas across the whole of the UK. And our ambition was that we really wanted to look across local government to see about how we could help local councils actually become more innovative and really thinking about what their challenges were and how we could support them in having greater impact. We wanted to help spread the whole concept of innovation across local government, and we wanted to raise the quality and the level of debate. So although we ended up working with quite a small number of councils, what we're really hoping is that actually the ideas and what we learn from those actually are relevant and pertinent to the rest of the UK. And we wanted to help innovation, as I said, across the whole of local government, not just within the councils we're working in. I'll put this whole slide up and then talk through it rather than piecemeal. Okay. So, the challenges, we made certain assumptions actually in terms of when we were designing this programme. There were certain assumptions we built into it, which actually were then tested when we went out for the open call for ideas. First of all, we felt that the only way that we were going to be able to address the challenges that were existing across local government was actually that it needed transformation, total transformation, as I said, not just service improvement or incremental change. We believed fundamentally that local government has the answers, that it was important that actually councils were supported in coming up with their own solutions rather than bringing external people in to actually help them with that. We felt that the answers absolutely lay within public services. And we also felt that we needed to get much better at systematically spreading and disseminating the whole concept of innovation. So, as I said, we went out for open call for ideas, and we expected councils actually to come back having actually collaborated with each other. And that was really interesting because we did have 137 responses, which is more than a third of the councils responding, and none of them had collaborated, which was really interesting to us. And we kind of think one of the reasons for that is because there was obviously a financial kind of gain at the end of the process. If you went through to the end and you were selected as one of the final 6, you were going to go on and get 2 years support, you were going to get grant funding, you were going to get non-financial support. And we think that actually created a kind of competitiveness in the process that stopped people from collaborating with each other. So that was really interesting in terms of, for us to think about how can we design programmes in future that would kind of try and eliminate some of that. We did shortlist to 17, and those 17 we brought together as Katie referred to, in Creative Council camps. And we did 2 of those with all 17 councils, and those were around helping those councils kind of really think about the challenge. Had they understood their challenge correctly? How were they going to test their challenge? How would they know what they were working on was really their biggest challenge? And we attempted to kind of get the councils to work with each other, to support each other, challenge each other, but still there was this kind of competitive element still within the process, which people found, I think, quite hard. We then shortlisted to 6 councils, and those 6 councils are now working with us for the next 18 months on taking their ideas forward. And those are, just for your information, in case you want to look them up, they are on our website. They're Rotherham, Wigan, Cornwall, Monmouthshire, Derbyshire and Stoke. So I've just been given my 3-minute warning, so I'm going to quickly move on to radical efficiency and talk you through this programme, which was very much around looking at how you could transform early years. The way in which this programme came about is that Nesta commissioned the Innovation Unit to look across the world at public-type services that were being delivered internationally to see whether or not they were doing anything that was radically different to what we were doing in the UK. They came up with 12 from across the world, analysed those and came up with some key characteristics which are then developed into a methodology which we put out across the UK with a call for councils to bid, not just councils, organisations working with early years to actually think about how could early years be delivered very differently. And the example we have here was Reading was one of those councils that bid, and they were one of the final 6 in the programme for radical efficiency. And what they did was they brought the whole council together to identify what was the challenge around early years services in their borough. And all of the stakeholders that came together, which were kind of your council officers, your executives, your councillors, all the various strategic partners, came together and felt that the biggest challenge that they faced was that families in a particular area did not have an internal locus of control. That actually they were dependent on services because actually the services had been quite paternalistic in the way in which they had been developed. We then tested that idea through ethnographic research, and we trained officers in the council to carry out that ethnographic research. They interviewed families to find out what the lived experience was of those families raising children who were under 5 in those particular geographical areas. And what they came back with was completely different. They came back saying that the challenge wasn't that they didn't have an internal locus of control. They did, but the services were paternalistic, they weren't working for them, and that they saw the families as a deficit as opposed to a resource. So they said very much, for example, when they stepped across the children's centres, you went there because you were in need of a service. You didn't go there because you had something to offer. And many of them felt that actually the sort of support they needed were from peers rather than from professionals. They felt they wanted more support for parenting, and that was really interesting because Reading had got quite a national platform in terms of the work it was doing around parenting support. It run national conferences, won a number of awards, but actually what the families were saying is they're great when you get on the programme, they're great when you go through the course, but actually you seem to have a problem to go on the course in the first place, and that's how they felt. So people wouldn't willingly go and access these services. And the consequence of that is that actually the communities had very little social capital. Nothing was ever changing within those communities. And though they had lots of kind of bonding social capital, so their mums, their sisters, their aunts, etc., lived in those areas, they didn't have any bridging social capital, so nothing was ever actually changing. So they changed the challenge. What the parents said was that and typically what we would have done as a local authority was actually probably develop something on the website, probably got our media and comms to develop some kind of glossy pamphlet, circulated those in the press, etc. So we went to the families with, this is how we think we might recruit the volunteers, what do you think? They said it was complete rubbish and tore it up. And they started again, and what they did was they drew a stick man on an A3 piece of paper and said, are you this sort of person? Gave some details, stuck it on a board outside the children's centre, and within 10 days had 60 volunteers. We also learned, because we had incentivised them through the ethnographic research to take part and gave them a £10 voucher, and some of them sent them back to us saying how insulted they were by that actually they didn't need to be incentivised to improve things for their own children. Thank you very much. So that was really interesting. So again, in terms of prototyping, when we wanted to know what would incentivise these families to volunteer, we asked them, and they drew up a whole thing around their learning journeys. And what they wanted was somebody to help them develop CVs, somebody who would help them access the right accredited training, and so on. This is their diagram. This is what they came up with a graphic artist, which is very much kind of their journey, starting off in the top left-hand corner with doing the piece of ethnographic research, then working out in the top right-hand corner what this service would actually involve in terms of their roles, bottom right-hand corner, what would incentivise them, what they wanted out of it, and then finally kind of going live. And in the time that they have been running, it took 6 months for them to go live, to be trained and to go live. And in that time, they saved 30% of that children's centre's budget and doubled the amount of families that they were working with. So if you do that in just one children's centre, and then you think maybe in that area they've got 13 children's centres, you start to get into the millions in terms of savings, and actually you've doubled the reach of the families that you're working with. So quite extraordinary outcomes. So I'm conscious that we're running out of time there, so I will pass back to, was it Eleanor?
Yes.
Yes, thank you.
Thank you very much.